human body contains an average of 5 liters of blood. A blood test is a laboratory analysis performed on a blood sample that is extracted from a vein using a needle. It can be used in a multitude of ways, such as helping diagnose a condition, assessing the health of certain organs, or screening for some genetic conditions. Although there are thousands of tests available, most standard laboratory tests only require 1 milliliter of blood for an adequate blood sample. A certified phlebotomist is an individual who is responsible for drawing quality blood samples from patients and prepares those specimens for medical testing. In order to obtain an adequate blood sample, a phlebotomist must follow a specific process, use sterile equipment, and proper technique. Today I would like to inform you about the specific steps necessary for a routine blood draw, including determining the proper location, prepping the site, and preparing for insertion. Before sticking a giant sharp needle into a vein, you must first determine the proper location. There are countless areas that you can use to draw blood from, and there are some factors to consider when choosing a proper location. Vein size is an important factor in determining the location for a routine blood draw. The bigger the vein, the easier it is to acquire an acceptable sample. Another important factor to consider is whether or not the patient is receiving medication through an IV. Drawing blood above an IV has the potential risk of erroneous and misleading laboratory test results. According to the CLSI guidelines, located at clsi.org, it is recommended using the opposite arm whenever possible. One more key factor in determining the proper location is the consideration of a patient's medical conditions. For example, patients with lymphedema require blood samples to be drawn on the arm that is not affected by the medical condition. There are some common locations a phlebotomist might select for blood collection. The most common location for a routine blood draw is the antecubital vein, which is located in the bend of the arm. These veins are typically the largest, and it's the least painful site. Another common location is the top of the hand. These veins are typically smaller and more difficult to collect blood from because they tend to roll once the needle is inserted. Once a location has been decided, the next step is to prepare the puncture site for insertion. Certified phlebotomists must prepare the site using aseptic technique. A tourniquet is a constricting device used to control blood circulation to an extremity for a period of time. According to an article titled Lab Test Procedure Performing a Venipuncture, located at www.akronchildrens.org, place the tourniquet tightly 3 to 4 inches above the puncture site. It should only remain on a patient's arm for 1 minute. It's important to remember to remove the tourniquet after blood collection is complete. Now that the tourniquet has been properly placed, it's important to clean the puncture site. To cleanse a puncture site, a phlebotomist must use an effective antiseptic swab or wipe. Clean the site by making a smooth circular pass over the site, moving in an outward spiral from the zone of penetration. It's important not to touch the site after cleansing to avoid contamination. The puncture site must be allowed to completely air dry for 30 seconds before proceeding with insertion. Once the puncture site has been completely prepped, it's time to insert the needle. In order for a phlebotomist to attain an adequate blood sample, they must use a sterile needle and proper technique. It's important to stabilize the vein before the needle is inserted. By pulling down and tightening the skin just below the puncture site, the technique will help you stabilize the vein if it rolls once the needle is inserted. Once the vein is stabilized, insert the needle at an angle of 15 to 30 degrees with the bevel facing up. It's important to keep a steady hand while inserting the needle into a vein because it inflicts less pain on the patients. As I stated earlier, most standard blood tests require a minimum of 1 milliliter of blood. It's important to collect the proper amount for the required test to prevent the patient from having to get stuck a second time. A vacuum or blood collection tube is evacuated to create a vacuum inside the tube. This means that once the tube is full, it will stop allowing blood to flow into the tube. Once all required tubes have been collected, the next step is to remove the needle from the patient's arm. Place a cotton ball or piece of gauze on the puncture site and carefully remove the needle from the patient's arm. It's important to hold pressure on the site until the bleeding has completely stopped. Once the bleeding has subsided, place a Band-Aid or Coflex bandage on the site. Always instruct the patient to leave the bandage on for 10 to 15 minutes in case the puncture site starts to bleed again. Let me end by saying my purpose here today was to inform you about the specific process and proper technique required for certified phlebotomists to obtain adequate blood samples. We discussed what blood tests are and what they are used for. We talked about certified phlebotomists and what their role is in the field of phlebotomy. And lastly, we explored the detailed steps of a routine blood draw. I hope that now, since you know the process of phlebotomy, you can focus on the phlebotomist technique rather than your fear of needles. Thank you.
That was way better.